Good afternoon. Thank you for joining us. I want to start out by saying that I'm Latoya Burtis. I'm a representative from Faculty Senate and also Administrative Faculty Senate. And today we're here to talk a little bit more about COVID-19 and masks here on campus. And before we get going, I want to do introductions. First, we have the VP of HR and Chief People Officer, Dr. Smith. Next, we have Brian Labus, who's Assistant Professor in Public Health. Next, we have Dr. Hvac, our Provost. And lastly, we have our President, Dr. Whitfield. So before we get started with questions, we're going to go ahead and pass it down and let each of the panelists say a little word.
Thank you, Latoya. Good afternoon, everyone, and thank you for having me. This seems like it's a recurring theme that we have these town halls and speak about COVID. I know that this is just another kind of test or another hill that we have to get across. But one thing that we have proven in these 2 years is that UNLV, we make it happen. And so we can get through this, and I know it's changes, and who knows how long this will be, but we will stand strong and pull through. So thank you for having us again.
Afternoon, everyone. When I teach my public health students, I tell them that public health sits at the intersection of science and politics. And that's exactly what we're seeing here. It's the challenge of knowing what we need to do scientifically and deciding what things are best for our community. And sometimes those things are mutually exclusive. We live in a city that relies on a lot of people coming to town and interacting to raise the tax revenues, but that's a really terrible thing to do in a pandemic. So how do you balance those things? It's not an easy question. It's something very challenging to do, but that's exactly what we're trying to do here. So it's not that we're ignoring science or following politics. It's really about the decisions we make as a community about what we're willing to accept, what the risks are, and what we need to do to provide the best protection while still operating a campus.
Thanks, Brian, and good to see those of you here in the audience today, and I know there's others online. Like Brian said, and Erica as well, this is clearly a transitional moment in this ongoing saga that we've been enduring for the past 2 years. And whenever we go through these kinds of transitions, it definitely raises questions and oftentimes anxieties. And so that's why we're happy to be here with you today to have a little bit of time to talk. This forum came about as a request from the Faculty Senate. We want to thank Latoya for being here to moderate from the Faculty Senate and pass along questions. But mainly we just want to share whatever information we have to make sure that people are on the same page, understanding the situation that we're in broadly and how we're moving forward together as a campus. And lastly, I'd just like to say how proud I am personally and of how the campus has been able to get through these past 2 years. We've really, I think, pulled together as a group and maintained a very safe environment as our campus. And so I think we have a lot to be proud of, and hopefully, knock on wood, this is the last of our stages of this very challenging period. And I think there's definitely reasons for optimism that things are going to continue to improve, but we do have to try to maintain safety while we get through this hopefully last phase.
Good afternoon. Yes, it's afternoon. I don't have much to add to, I think, the pertinent points that were raised as we start off. I just want to say thank you. I talk to lots of people from around the country and see how other universities have adjusted, shifted, and we're at the top of the heap in terms of how we've done that. But the we is truly a collective we. Thank you all for stretching yourselves to change the way that you teach. Thank you for making yourselves available in situations where you interact with our students. All of those things are critically important for our university. And we've said it a couple of different ways, but there's a part of me that says, let's not think about this as we're waiting for it to be over. There's much to believe that the situation that we live in, which is that there will be viruses that can cause illness and death, will exist with us for the rest of time. And that we really need to get our heads around how we actually live with viruses and be able to adjust with them appropriately and making those kinds of decisions. And I'm glad that we do that as a community. So we're looking forward to hearing your questions. We'll do our best as we can to be able to address them. I think too that some of them you may not fully agree with. Just understand that we really do try to do our best to accommodate as many people to try to make the campus as safe as possible. But one of the things that I think we should actually think is a positive is that there's a little bit more freedom, and we're not being completely run by policy. We actually have some individual choices that we make. I would just hope that we make choices individually to be as safe as we can. Thank you.
And before I hand it back to LaToya, I want to plug National Recreation Day. LaToya has left the post of running National Recreation Day, which is over in the Student Recreation and Wellness Center. And so if you have a few minutes after this conversation, you might want to pop over and see the various activities there. And also, I think it might be useful to have Brian give kind of his state of the pandemic talk. Brian, I think you know, is very well rehearsed in that. And if you haven't heard, we've had since the beginning of the pandemic an incident management team that's a large gathering of campus leaders, co-chaired by myself and Greg May. And Brian is a key consultant to that committee, a member of the committee. And we always start by sort of what is the state of the pandemic at the moment. And so I think it might be a good place for us to start for Brian to just give us an update on where things are at in the pandemic current situation.
Well, things are heading in the right direction. The numbers have been going down since we saw the wave that was created by Omicron, and so we're on the backside of it. I think people have misunderstood that as things are getting better with things are over, and I think that's caused a lot of confusion. We are still seeing significant disease in the community. Hospitalizations are starting to go down finally. We're seeing less disease, but that doesn't mean it's gone away. It's still here. It's still something that's spreading, and if we stop doing anything to control it, it could very easily flare back up. The analogy I usually use when I talk about disease spread like this is fighting a wildfire. And you can't just stop half the wildfire and expect it to get better on its own. Things are going to ebb and flow over time. But until we have things completely under control, there's always that potential that things are going to flare up. And people want this to be over. They want to be at the end of it and never wear a mask and never think about COVID again. Even if things are better, we're just not at that point yet. So we're going to have to consider those things for a period of time that seems a little long for people just because it's not over yet. It's still spreading. And we continue to see new variants. The new Omicron variant, the BA.2 variant, is one that we're seeing a little more transmission of in the community now. We'll see what that means, and that's going to continue to happen. We could have new variants show up at any point in time and completely change things, or we could continue on the same path that we're on. I think we're heading in the right direction. We're just not at that final destination yet. So please don't give up those things, even if you want to. I want to stop doing all that stuff too. But we're just not at the point where we can comfortably do that and say that things are over and we've gotten past COVID. And I also, I like Dr. Whitfield's comment that, this is not COVID being over. There are always going to be viruses that are around. There's always going to be something here that we need to think about. And the problems that we're wrestling with now are the same things that we've been dealing with, at least in my for 20 years. What do you do with people who are sick? Do you make them go to a doctor, get a note to come to work and things like that? These issues have come up more frequently because of COVID now. We're talking about them, but they're not new problems. And unless we do something now to deal with those, they're going to continue into the future. So COVID is just another example of one of the many diseases we deal with. But right now it's kind of front and center. It's just not over yet. So please, even though you're excited about it being on the downside of things, it's not over yet. We're just not at that final destination.
All right, well, now that we've had a very comprehensive introduction, I want to get started with questions. And the first one is, may faculty require masks in their private offices if they also provide WebEx access as well?
I can take this one. So I think if we kind of scratch out require and say request, that would be a better thing because you are offering web. So you can say something to the point of, hi, if you meet with me in my office, I would prefer that you wear a mask. If you find that this is a problem, we can absolutely set up a virtual meeting. So when you start saying required, that's a different type of, that's a mandate. And so right now the governor said that there's no mask mandate, but you can absolutely let that be known that your preference is that people wear masks.
Thanks. And let me just add, one of the roles that I've played during the pandemic is having been a member of the NSHE COVID task force from the beginning. And so definitely the governor ending the mask mandate is one of the things that's really caused an increase in tension. And I think there are definitely many people, and I think I can safely say that Brian is one of them, who said that that decision came a little bit earlier in the downward progression than would have been ideal from a health perspective. That being the case, one of the things that the system has been clear about with all of the campuses is that they consider the mask mandate issue one of policy. And their determination at the moment is that those policies can only be set either by the governor or by the Board of Regents. And so they have been clear to us and the campuses that we can't impose those kinds of restrictions on people, either in classrooms or offices or anything else. And so I think the president and I, and I'll let him comment, have been definitely advocates of having more local control over those kinds of decisions. And that may be something that will get discussed at the board level in the not too distant future. But it isn't something that has been authorized at this time for there to be campus control. And if there's not campus control, then as Erica Smith said, there's not individual control on those issues either. Yeah. Okay.
All right, next question is, will vaccination requirements be set for any events on campus?
So the answer to this question is the same as the one before, is no, we are not in a position to set vaccination requirements for events on campus.
The next one is about room scheduling for classes. Can we redo the room scheduling algorithm to put each class section into the largest room available? For example, not trying to squeeze a 20-person class into a 20-seat room if there is a room available that holds 60.
I think Provost Hvac should have sat right here, right?
So I did have a conversation with the registrar about this issue this morning, and this can't be done on an automatic basis because the system that's used to automatically assign classes is designed to maximize the efficiency of classroom assignments. But if there are people who have rooms that they feel are tight in terms of the enrollment, they can send an email to the registrar's office and see if there is another room available at that same time that they could switch to. As we move some additional classes to remote just before the start of the semester, we may have some additional classroom flexibility. In a normal semester, we essentially use during most of the classroom hours, almost all of the classroom capacity that we have. So the amount of flexibility there is going to be limited, but certainly people can make that request to see if they can move. Beyond that, we're not going to do any automatic reshuffling of classes in rooms at this point because of the amount of confusion that would cause with students. But again, faculty members can make that request.
Being that we all know how fast things change, if another variant emerges that becomes a threat, do we have a provision in place with NCHE to reinstate the mask mandate in a reasonable period of time to help keep the campus community safe?
So, I don't want to be too redundant, but the answer to that question again would depend on the Board of Regents. We are actively having that discussion about who has the authority to do that. And right now that authority rests with either the governor or the board. The incident management team continues to meet and monitor the situation, and definitely we will adjust if needed to maintain campus safety if another variant emerges or things get to be worse on the campus. As you probably know, if you go to the COVID website, you can see the dashboard that lists the number of cases that we have on the campus at any given moment. And one of the things, if you look at that, there is a steep downward trajectory. And we're now looking to be in single digits now each week of number of cases on the campus. And one of the things, and I'll let Brian comment on this, is that we've been consistently below the number of expected cases on the campus compared to the community rate. And so that's one major testament to the fact that we've been able to operate very safely during the pandemic.
So our numbers are much lower than what we'd expect from the community. We look for clusters, we look for those things. And if we identify problems, we can have individual responses within a classroom or something like that if we were to see a cluster. When it comes to the bigger issue of new variants, I think if a new variant showed up that had 10 times the death rate or spread 10 times as easily, it's a new game. And it's not just going to be UNLV or NSU looking at that, it's the entire community. We did this last year. We did it when we removed the mask mandate for a few nice weeks, and then a new variant showed up and everything changed. And the mask mandate went back in place starting from the governor. So I don't think anybody wants to see any restrictions or any mandates back in place, but if we have another situation occur where that's necessary, it's going to be a community-wide issue, and those decisions will be much bigger than our campus, and we'll all be trying to respond as quickly as possible.
I feel these next two questions have been addressed in a way or another, but I do want to offer the questions just because it's time to submit them. The next one is, I understand that employees are not required to wear masks. However, I am immunocompromised and am not comfortable with people without masks in my office or an enclosed space. I would like to be able to respectfully request that those who come in my office or my personal space put a mask on. I don't feel like I can make this request without retaliation. Would the university put into practice or as a policy allowing people to request masks in personal spaces? And then the person ended with, thank you for your consideration.
Well, you're welcome. So I think to reiterate what the provost emphasizes, that right now we have to follow the governor's orders. And so until that is turned over to the Board of Regents and they decide otherwise, then a request is what you would do. Now, if someone says, I prefer not to, of course, you can go back to requesting virtual and scheduling virtual meetings. But yes. And excuse me, to mention a portion about retaliation, we have been very serious in our messaging for everyone, asking everyone to respect people's decisions, right? And so some have masks, some don't, and that's a personal choice and an individual choice that people have to make. And so if folks request that they wear it and you prefer not to, then absolutely you should agree to do virtual. There should be no retaliation and no other negative kind of correspondence because one chooses one or the other.
And Brian, I wonder if you would comment on the notion of the safety that comes from wearing a high quality mask yourself, even when you're meeting with someone who's not maskless, and the continued value of vaccinations.
So just because the mask mandate went away doesn't mean the recommendation has changed. We still want people to wear masks because it still is a great way to reduce transmission. You wearing a high quality mask, though, adds an extra level of protection beyond what we've been doing for the past couple of years. We had people wearing just basic cloth masks, things that would make it home. And the recommendation more recently is turned to KN95s or N95 masks, which are a completely different level of protection. Now, they don't fall quite on that in that category of PPE yet because you're not fit tested for them. It doesn't follow all the official OSHA rules. But if you're wearing a high quality mask properly, it's going to significantly reduce any risk you have of being infected, even if the other person isn't wearing a mask. I would also add, maybe you don't have to stay in your office. If you're concerned about being in a tiny enclosed space, go to a conference room, go sit outside. There are other things you can do that will reduce that transmission, even if one person is not wearing a mask. So you can be creative about it. Just think of the amount of time that meeting needs to be and where you're holding it. And there may be some options other than just having it in your office or online and that's it. There may be something that works for everybody involved.
All right, this next question has a couple parts to it. So considering that one, BA2, which is the next variant of COVID, is thought to be significantly more contagious than Omicron with potentially more severe symptoms. And two, community cohesion is extremely poor when it comes to masking and vaccinations for COVID. Three, Nevada's 2-dose vaccination rate is not great and the booster rate is extremely low. Four, BA2, also referred by some as Omicron 2.0, is thought to be dominant in the US by March. And lastly, number 5, reinfections are expected to be more likely. Reinfections are expected to be more likely. Therefore, what is UNLV doing to prepare for the next surge in cases? How is UNLV demonstrating leadership on this in Southern Nevada and at the state level, given the recent about-face change to our policies? And if I need to repeat any of those, let me know.
Sure, I can start and talk about the new variants. everybody's focused on BA2 because it's the next variant of concern that we've identified. But for me, I don't quite look at it that way. I look at it as it's that variant or whatever the next one is that's way nastier, or one that is much more mild but spreads more easily. We don't know exactly what's going to be next. And so everything that we've done for the past 2 years is focused on there could be something else coming down the road that we're just not seeing yet. We could have a change in the virus that makes us change our plans. And so that's kind of been the mindset we've had with everything. So I don't think the most recent changes in the mask mandate have done anything to change the way that we've approached it. We always know that there are changes that are going to happen and we'll have to be able to respond to those. That's why we're continuing to do disease surveillance. We're tracking all the things, both locally and following what's happening in the community and internationally, and trying to set ourselves in the position to be able to respond to those things. We still have our full response infrastructure in place. None of that has changed just because the mask mandate changed. My team is still taking cases every single day. We work with housing, we work with the classrooms, we work with maintenance facilities, we work with everybody to provide the safest environment possible. And that hasn't changed just because there's a new variant or terrible mask use in the community or nobody getting vaccinated. It's just a challenge of public health in Nevada. You know, we're kind of last on the list for most things, but it also gives us a lot of opportunities to do some good. So I think the mindset hasn't changed at all. Now, of course, everybody sees it as different, but the approach we've had on campus, really the only difference is the rule that says you have to wear a mask or not. We still want people to wear masks, and we're still doing everything we've been doing for the past 2 years to help remain safe and protect our entire community.
Have you seen anything or been monitoring the wastewater monitoring data?
Yeah, so we have the wastewater data, and as we're seeing locally and kind of nationwide, BA2 is starting to increase. We're also seeing a huge decline in cases though, so we haven't seen a big spike in BA2 cases in the community yet. It may take over as a dominant strain, but it doesn't mean that there's going to be a massive surge of that. So right now it's still kind of a holding pattern, wait and see what happens, but we are seeing BA2 locally and around the country.
While COVID has lasted much longer than any of us may have expected, how will the allowance for remote work be made equitable?
Yes, I will take that over. So the president and the provost actually have said consistently that we are not an online campus and that we are here for the students, and that our interactions, faculty and staff's interactions with the students help make their experience better. And so while I understand that because if you are student facing or community facing, you feel like you can't do remote work. But what I always caution is that the flexible work policy is more than remote work. And so we want to make sure that you have the ability to be flexible, and managers have the ability to be flexible within a policy to help individuals with their lives as we've shifted in this COVID state. I also want to say that HR is creating some tools to help managers and employees kind of look at, okay, this is what I do, this is what options are available to me, more of a decision tree. Could I do remote work? Could I do flexible work? And so I just want to continue to emphasize that flexible work policy is just that. It's not a remote policy. So while remote work is included in the flexibility, there are some other options that are available to faculty and staff that don't include remote work. And so we're hoping that at some form of the policy, people will be able to take advantage of it. But to say everyone can remote work while we have 30,000 students on campus is just not reality. But we want to make sure that you have options available to you.
And so one of the things I'll also say is that we did have a discussion, led by President Whitfield at our last cabinet meeting about this issue. And like the pandemic, it's an evolving situation. We're trying to understand the world of remote work. And Erica said that she's developing new tools. And so we don't feel like we've gotten to the end point of this discussion. We're really in chapter 1. And now we're thinking about what chapter 2 of this discussion looks like as we try to kind of find our way forward.
Right. How will students who test positive for COVID be academically supported going forward? Will they have to quarantine, and for how long?
So our isolation and quarantine policy follows whatever the CDC recommendation is. So that is not under our control. We've been following that just like everyone has throughout the country since the beginning of the pandemic. Isolation started with 10 days. Now it's 5 days. And then you have to wear a mask for the second part of those 5 days if your symptoms have disappeared, if your fever is gone and you're feeling better. So it comes down to whatever the rules are on isolation and quarantine from the CDC. We will continue to follow those. The shift we've had this semester is to try and take administration kind of out of the piece between the student and the faculty member. So if the student's sick, my team will interview the student, send them a letter that says you can't come to class for this amount of time, you can't come to campus. And then it's up to the student to work with their faculty member to figure out what the best approach is based on the policies for that class. And so professors have been dealing with sick students forever, and this is just another example of it. And so that's how we support the students. If there are problems with that, obviously there's a process by which you can take your complaints to whoever, depending on which department it is or what the issue is. But we really wanted to make it between the student and the faculty to figure out what makes sense, rather than one of us from the outside saying, you have to do this sort of thing. And basically just allowing the faculty that flexibility to run their classroom and treat an illness for COVID like they would an illness of any other type.
Yeah, and we'll just say, just to add to what Brian said, that when difficulties arise, we do try to make sure that we mediate those, and the best place to start is the department chair, and then we engage deans in those discussions. And our messaging to faculty has consistently been that they should try to be accommodating to students during this challenging time. And one of our clear priorities is not having sick students come to class. And so we don't want faculty members creating conditions where students are hiding their illness and coming into class and thereby putting other people at risk. So it is a challenging circumstance for everybody involved, students and faculty. And we're trying to, navigate that, as Brian said, on the best case-by-case basis, depending on the situation that particular course and that particular student, et cetera. We want to see if the people in the room have questions.
All right. That was actually the last question that received prior to this meeting. And so I want to reach out to the audience and see if anyone here has any questions they'd like to ask.
Comments?
Or comments?
Complaints?
No.
Suggestions? Tough crowd.
Rob has one.
This is a little more kind of on the fringe of this, but I think it relates. And one of the things with the pandemic is also the coinciding with the quote unquote great resignation and the number of vacancies we have on campus. My entire professional staff has left during the course of the pandemic. It's and I'm holding it together by a thread, and just what efforts are in place. I know, Erica, I know your staff is much like mine. There's a lot of vacancies, even in HR right now, which goes to exacerbate, I guess, the number of vacancies around campus. Are there any efforts underway to try and prioritize, expedite, incentivize people? I think UNLV is a great place to work. I like it here. How are we getting the word out, or other things that we should be doing to from the trenches?
Thank you, Ron. So the great resignation is real. And to your point, I have experienced it myself. And so one of the things that we're doing as we are interviewing, and even the pools are smaller, right? You used to could post a classified ad and get 150 to 200 people. You may get 20 to 30 people. What we've learned and what we're kind of asking managers to do, it's going to change a little bit when you're interviewing people, your framework or what you think makes a person qualify for the job. We want to make sure that they have certain competencies and they can lead, but a lot of times you want to see if they've done something in a different area that can translate into the area that you need. Start kind of broadening your thinking process of how and what a great candidate looks like. Because, do they have the capability, the capacity to learn and understand the process? And do they have more of the other skills that you need to apply? Now, HR, we have hired some LOAs to kind of help with, because not only is HR going through it, but the entire campus to kind of help with the transition and help us move through. But it has been difficult. I mean, just for an example, we offered someone the position, they had 2 other offers by the time we got, and we were relatively quick. So it's all about patience. It's all about readjusting what you believe is a perfect candidate for your position. And if you need assistance, you can call us. I mean, we're here to help guide you through that. So if you're looking at resumes, or if you've spoken to someone and you say, I don't know if this person fits, I like them, I think, but this is not the ideal candidate who I would have chosen 2 years ago. And so we can help you kind of walk through that as we move through. They predicted this. Researchers predicted this 3 to 5 years ago, saying that the workforce was going to become smaller. And so it just kind of, I think it was the big storm, what do you call it? Perfect storm. You have COVID, you have retirement, and then you have people who are just kind of resigning and deciding to do other things with their life and priorities. So we're here to help you. We'll survive this. We will help you survive it, and we will get through it on top. So
anecdotally, my last search, my 9 top people were through.
Things through the benefits.
Yeah.
yes. So Rebel Reset, of course, can help not only managers, but employees kind of, it's a total kind of wellness package, right? So it's not only to help you, it's not necessarily help you recruit people, but it will help you kind of escape for a while. So we have the chair massages that were a big hit. We also had some moving challenges, and people love that. We also have meditation. If you want to kind of take an hour or 45 minutes to meditate, we have cooking classes that you can do, that we talk through health as you're cooking, just to kind of help you kind of mentally reset, because it's a lot on us as managers and employees, right? Because if you have a smaller team, you're on the team, we're asking you to do more. And so thank you. We see that and we know that, but we still have to get the work done, right? We still have to get the work done. And so Rebel Reset, hopefully, is just something to help you kind of balance all of that, help you balance that out. And so we continue to have new programming as we go along.
All right, and just to follow up on the perfect storm that you mentioned, just to also keep in mind that regardless of what department you're in, we're kind of all in the same boat. So this is the time to check on your colleagues. This is the time to say hi or send that email. Or when you send the email, don't go straight to, excuse me, Dr. Smith, can I have that? It might be the time to say, hey, I just want to check in and see how you're doing, because we are all in the same boat right now.
Thank you. The past 2 years has been difficult for families. Financially, people have gotten sick in families, people have passed away in families, whether it's from COVID or just old age or whatever. What has UNLV done for the staff's morale lately, or plan to do in the future for staff's morale? You said, speaking of massage, meditation, great. Travel's been here and there. I know some people travel, people can't get out because of COVID. So my question again is, what has UNLV done or plan to do in the near future for the morale, for the staff's morale here at UNLV? Thank you.
I thought Eric was going to answer first and give all of this great information, and then I just, try to move in. I am not dodging the question. Actually, I'd like to know what you'd like to have to help you with morale, because I think things like the Rebel Reset program, we've encouraged, I don't know how far it goes down, but I know Provost Stein talk about this, and I know he does it with his leadership team, of making sure that they, it's funny to say, but sometimes you want to encourage people to think about being compassionate. It's just like, I think what was said about making sure that you don't just come across with your ask. And sometimes we feel a little heavy-handed that we don't want to, say that people have to be a certain way, but just to really encourage that the way that we get through this is that we get through it together. We don't get it through it as a bunch of individuals. Now, one of the things that changed is that we get to make some individual choices now. With the mask mandate being lifted, there's those individual choices, but as you heard, it's still to encourage people to say, there's a way that I can make my individual choice, but I can still help that other person. I can help that student do others. So do you have any suggestions? I mean, anything. We're short of increasing pay. We're doing a little bit, and even a little bit more this summer. But are there things that you could think of that you could suggest to us?
I think staff just needs more recognition. I think increasing pay is great. We all need a little extra money in our pocket, but at the end of the day, once the money is gone, then the attitudes are back. But I really think that administration needs to just slow down and just think about their staff just a little more, about what they're doing, how they're doing. There's a lot of administration. I understand that everyone's busy. I get that. I get that you all are busy. We get 1980, we had 8 emails daily. Now we have over 100 emails daily. I get that we're busy, but are we too busy just to stop and say hello or how you're doing and stop to listen? That's all people need. It's just that moment to listen to one another and say, hey, you did a great job. You did a great job completing that task, or, do you need anything else? And that's really what people need, is compassion, empathy, and to be heard. And if we can just stop, open our doors, and listen to one another, it'll just be a better place and a better campus.
So I agree 100% with you, and I understand and hear what you're saying. And I also understand from President Whitfield's perspective. I think in asking, what do you need? One thing about engagement and inclusivity in climates is that, yes, we are responsible for climate, and one other thing is that you are as well, right? And so together we have to do the climate. There's nothing, we can give the message all day and say, ask how people are doing. And wellness is important to everyone sitting at this table, right? And mental wellness is just as important as health, as physical health. And so we want you to understand that, but we also want you to understand that you have to tell us what you need. We can't do this alone, and we can't implement it alone. We can, FDH and over at CSB, I can send out emails all day and say, see how your people are doing. But if you see someone, your colleague, you stop and say, how are you doing? And then the next person does it, it changes the climate as well. And you have the support from all of us. So please, we have now, I was going to announce this via email probably tomorrow, but we are putting a solutions box on the president's website. And in there, it asks you to tell us a problem and tell us a solution. So it's not a complaint box, right? And so it's somewhere where you see a problem, now tell us how to fix it. There's no promises that all solutions will be addressed, but some, I guarantee you, we will have some good solutions that come from this box. And so you help us. And contact me, email me and tell us, say, hey, Erica, I think this is a great idea. We should implement it, and I'll call you, we'll talk through it, we'll see. But yes, I agree. I think it's our jobs as well as everyone else's to make the climate better.
Thank you.
Let me just add, and then we'll pass to you, Doris. I really want to say that, President Whitfield has come in with a real focus on wellness. This is something he really talks a lot about with the cabinet. And one of the things that reflects that directly is he changed the title of the Vice President for Human Resources to also include the Chief People Officer. And he's really championed the wellness programming that's been now offered through HR. And as a campus, I think we do, as I said at the beginning, have a lot to be proud of in terms of having maintained campus safety, having been very flexible and at the cutting edge of implementing the flexible work policy. And I think Erica and her team really were leading the NSHE bandwagon to implement flexible work. And I know that we haven't perfected all of that yet, but it's definitely something that we're continuing to think about and try to refine. So I think that there are a lot of things being done. It is also a challenging time with the pandemic and the Great Resignation and all of the various factors that have come to make this a little bit of a high pressure time. And so I know the president, speaking for him, has continued to think about how do we support the faculty and staff of the campus community.
And it was a great point, Provost TV. The only thing I would add, and it's just to double down on what was already said, which is that some of the problems that we see, some of the solution starts with us. And we all have to think that this is the part that may be a change for some people, is thinking that you're actually the agent for change. That even if it's, sometimes we think about, and I hate it, but it exists, this stratification of that there's this level and this level and this level. And that this level has to be the one that sets culture. This level will tell you all the time, the culture begins with the people that really are at every level, and that take a moment and just remember that while you might have a supervisor who was a great supervisor before the pandemic, and all of a sudden they're not doing as well, or you don't hear that kind of thing from them, it's because they are people too, and that they are going through things. They are having family pass away. They are having family who's sick. They're complicated with childcare. They're complicated with just the stress of trying to navigate this. And so we have to do that at every level, though. This is just talking about one way, but we need to do it at every level. And so the supervisors that are out there listening, this is to you, to the staff that is out there, this is to you, it's to everybody. Take that moment that's being suggested. I'm with you 100%. Is just take a moment and think about it. And it's a change in style. And wouldn't it be incredible if from the pandemic, we actually changed the culture of our university? That we had issues with it before. It wasn't perfect before. It wasn't a panacea, but it's under these stressful conditions. We actually have an opportunity to make ourselves a better campus. And so I really appreciate your point. I think it's well taken. And I don't believe I'm going to suggest this, but I do suggest that you take a look at the website tomorrow when it goes up and, bring the problems. We're not afraid to hear them. We just want to hear your smart brains help us figure out things that we could do within some of the limits and the constraints that we have to be able to try to make the campus better, both in terms of how we function, but also how civil we are to one another. It's about the person-to-person contact. That's what this one issue is about. And I do think that we can be better. We just have to be cognizant of it. We have to actually think that way. So thank you.
Yeah, Doris. Yeah.
And just to add to that, I sit on the NSHE Mental Health Task Force, and we actually met yesterday. And we are looking at, initially it was like very student driven. And now we're at that point of you cannot forget about faculty and staff. And so the team has broken up in subcommittees. They're looking at EAP resources and what else can EAP offer. We're going to be putting out surveys to find out more solutions. What do you need? And again, it goes beyond just being short staffed. So there is more coming. And we are told almost every week that fully supports the mental being of UNLV and all of NSHE.
Okay, so before I get started, I just want to thank everybody for the town hall thing, but I also want to speak to me as a private citizen versus me as a UNLV employee. So in the outside world, all of a sudden, masks you can just get away with, just do away with masks. And then shortly thereafter, as a UNLV employee, we're hearing the same message. You can get rid of the mask. But before that, like just a month or so ago, it was like, get your 2 vaccinations and hey, even get a booster. So now am I protected now that I can do away with the mask? Or do I still need to wear my mask just for that extra layer of safety? Because it's like mixed communication. So I would suggest, well, this is good for the town hall, but I wish we had got better communication before it led to the town hall, so that I would feel safe in an elevator. Like, can I drop my mask in an elevator or in the bathroom or whatever? So it just would be better for me as an outside employee, as a private citizen and a UNLV employee. What is really going on? Can we get rid of this thing altogether? Is another booster coming down the pipeline? Like, what's up?
I just did an interview on this a couple days ago, and what I explained to them was the challenge of the public understanding how science works. Usually what happens is all the science happens for a few years, there's a final decision, we tell people what to do, and everything's kind of settled. But right now, people are watching studies come out, they get covered as soon as they come out. Nobody used to cover every academic study that came out in a journal in the media, but that's happening now. And so the public is watching us in our deliberation process, and as a result, they think it's completely confusing and nobody knows what's going on. And I think that's been a big challenge. It's nice that people are very interested in all these things, but a lot of times we don't have the answer yet. We can't tell you what's going to happen 10 years after you get COVID because nobody's had 10 years pass since they got COVID. We have to study those things over time, and that's been a big challenge. And I think that has been very difficult, especially over the last few months, like you said, with all these changing rules now with the masks. 2 months ago, we were telling everybody to wear a mask, and now the rules changed. We're not requiring that people wear masks. We're encouraging them to wear masks. And the way I describe it is kind of like the masks and the vaccination work together. That's why you have seatbelts and airbags in your car. If you have airbags, you still should wear your seatbelts. You put those things together and that gives you the best protection. People see the world as kind of a black and white sort of thing, and it's a gradient. There's a gray that we live in, and there's a certain level of protection, and it depends on the situation. So there isn't an answer for every possible situation to tell you what to do. We give you the best information we have and say this will reduce your risk, but it will never fully eliminate that risk. And I think that's been the other challenge. Even if you do everything right, you can still get COVID because that's reality. You can really reduce your risk, and we can look at the population level and say people that have done all these things are 100 times less likely to get disease than those who've done nothing. We can give that sort of information, but then there's what happens at the individual level. People that do everything right sometimes just have an unfortunate set of circumstances and wind up getting sick. I think this is the big problem that's occupying public health right now. How do we communicate all this? Because it really is a new way that people are following information, listening information, sharing information. Everybody wants to blame social media. It's just another way for people to communicate. And you're getting information on studies the second they come out, where before it would have been years before you heard those sort of things. So I wish I had a good answer for you. That's really something that's going to occupy my field for quite some time. How do we get our communication to the public and get them to change their behaviors when all this competing information is out there? I don't think we have a simple answer, unfortunately.
And Brian, would you say that, share some of the data about people who have had the full set of boosters and are up to date with or vaccinations and are up to date with the booster are at dramatically less risk for serious illness?
Absolutely. So the more things you do, the lower your risk is going to be. But then it comes down to your individual immune system. So if I had the exact same schedule of shots the same day you did, our immune systems are not going to give the same response. And I don't think people think about that. Your body plays a big role in this. If you have a weakened immune system, you may need to get an extra dose to be up with everybody else. And even then, your protection is not going to be as good. And if you get sick, you're probably going to have a worse time with the disease. That's the uniqueness of your immune system and the real challenge here. It isn't like you get the shot and it's done. It gives you the best protection possible. And from everything we've seen, if you're up to date on your shots, you have a much lower risk of getting the disease to begin with. And if you do get it, you have a much lower risk of being hospitalized or dying. And even as some of those other risks change, your risk of being infected may go up. We've still seen the hospitalization and death protection last for quite a long time. And so it's not perfect, but it still is giving you that protection. The more things you do, the more protection you're going to have. So when you combine being fully up to date with wearing a mask and avoiding close contact with people and all those things, it's going to give you the best possible protection.
Any questions online?
We have one more.
They can go.
Some of those, because we.
There are a number of questions regarding employee vaccination requirements and testing requirements, both questions regarding what is the current state of affairs and why are these rules still in place?
So the, well, do you want to?
Okay, so NSHE approved a policy, the COVID emergency policy requiring vaccinations. That is still in place. I believe in the policy it stated that the board would revisit it at the beginning of the fall semester. So therefore, all new hires must be vaccinated before they start work. And so, or request a waiver. So that has been in place and will be in place until the Board of Regents tell us otherwise. Yes, so the testing requirement are for those with waivers, so medical or religious. That begins the week of February 27th, so coming up. And the test will be required at home. There's really a telehealth process that will go through, and waiver employees will be able to take that test weekly.
There's another question regarding the HVAC systems UNLV is doing to protect them.
Sure. So we've been dealing with this sort of thing. How do we make campus safe for the past 2 years? The question is about the HVAC systems and what we're doing. The challenges we've had on campus are that there's new buildings and there's old buildings, and not every system can do everything. But there are recommendations from the CDC that we follow as to how many air exchanges per hour, the types of filters and things like that. So for the past 2 years, we've been doing that sort of thing. There are still spaces in campus that have terrible airflow, and we know that's the case. We've had issues with music practice rooms and things like that. That one has come up repeatedly. We've done everything we can, though, to follow the national guidance on what should be done to provide the safest environment. And given the limitations of the systems that we have, follow those things as best as possible. So we've been doing that for 2 years. Nothing has really changed with that. That's just part of our overall response in making campus safe. We've been doing that since we first identified COVID.
You want to comment, Musa, more?
Professor Liv was, he emailed it. Thank you.
Okay. Musa Payam is back here, and he's in charge of these issues for the campus, and he's on top of it, working hard.
Another question is, what beyond candidates for vacant positions, this was Dr. Bob's question, what is HR doing to ensure that administrative staff are being paid appropriately? What are departments doing to maintain
So HR receives equitable requests, and we also, when you have a new position come in, we do what's called a compensation review, and we review internally and externally and provide ranges to your managers and leaders. Now, sometimes the ranges may be outside of what the budget is. And so at times we have to accommodate the budget, but we know HR makes lists and informs managers that indeed we may cause inequities. However, we feel like we still have to continue to push forward so that, addressing compensation is a slow process, and it's an expensive process. And so we have to do it in stages, and we have to do it each person at a time to move forward. And I think even since I've been here in the 3 years, I think UNLV has done a tremendous job in addressing inequities, and we will continue to do so.
One more, and then closing comments from the president.
And given that we can't have a mask mandate in place, is there a possibility of switching more courses to remote?
Not at this time. We did offer faculty members the opportunity to adjust their course offerings before the semester started, but now that we are this far into the semester, we think it's very unfair to students to adjust the nature of course offerings. And many of those students who were in those classes definitely chose them because they wanted in-person instruction. And so we are expecting faculty to maintain the courses in the mode of instruction where they began at the beginning of the semester. And again, and I'll let Brian say, his comments about this, because I think he's teaching in person, is faculty members who are wearing, high quality masks and are vaccinated, we do believe are highly safe. Nothing's perfect, but I'll let Brian comment.
Before I mention the masks, keep in mind that we don't have a student vaccination mandate, but we did when everybody signed up for class. So we have 91% of our student population vaccinated. That makes a huge difference in the overall safety levels on campus. That number will obviously go down in the fall as you have new students admitted who may not be vaccinated. But right now, whether we have the mandate or not for vaccines, everybody is vaccinated. The masks themselves are still a way that you can protect yourself. I don't know that my class is a great example of what every class is like, because I teach a graduate class in infectious disease epidemiology. So it's a bit of a skewed population there. But when we've done some observations on campus, I think we found about 60% mask usage, which is a little higher than I was seeing out in the community in general, which is in the upper 40%. But we're still seeing some people wear masks, and really it's a combination of things. It's not one thing that's going to make or break the entire response. We have high levels of vaccination. The faculty members can wear masks. Some of the students are wearing masks. The faculty member can socially distance a bit at the front of the room. Even in a packed lecture hall, you're not having everyone crowded around you like at a concert. There is some distance. And those are still the things that we can do to protect ourselves. But upgrading your mask is going to give you a big advantage as well. There's a big difference between the cloth masks that you would wear and like the KN95 that I'm wearing, or the N95 mask, because the pore sizes on those masks are much smaller, so it filters out a lot more and provides a much better level of protection than just any of the basic fabric masks that are out there.
If you would, let's thank all of our panelists for the incredible insights and information they provided. It sounds a little self-serving since I'm sitting up here too. And I feel horribly guilty because I do have a KN95 mask and I grabbed the first one. I mean, that's another thing that we have to deal with, is remembering the additional safety that we get from these other masks and that those are available to people. I don't want to say too much other than that. This level of discourse and discussion and engagement will continue. One of the things that I get an opportunity to do is to talk to presidents nationally. And I really do think that we're much more open to having these conversations. And they're tough conversations, and they're things where some of it, there's not a perfect solution. There's not a perfect solution to what we're dealing with. The way that we're going to deal with it and be successful, which, as you hear from some of our numbers from campus, we are being successful. I hate to say it but it's almost safer to be on campus than it is to be out in the city. The rates are lower on our campus, and it's because of what we are doing. So even though it may not be perfect and all the things that you'd like to see happen are not happening, we're doing a lot of the right things. Are we doing the perfect thing? There's not a perfect thing. And there are always two sides to some of the perspectives that we have on how we actually are safe. But I think, as Brian has said a number of times, and I want to just again thank him for how much leadership and thought that he has provided for us in trying to get through this, is that it's about risk mitigation. And the risk mitigation now comes to the individual level of that. We do encourage you to wear masks, but if you don't want to, you are free not to. And it's important that we shun no one. We don't shun those who wear masks, and we don't shun those who don't wear masks. I think it comes back to the point about the compassion that we need to share for each other, of that there's lots going on for everyone these days. And I think the provost and I, we're both have psychology in our background, so I think it's sometimes first and foremost. And Erica, we might make you an official, an unofficial psychology person, because we talk about wellness all the time. Brian reminds us all the time about the physical pieces of it, but there's the emotional and the mental pieces of it that's going on for everyone. So please take that moment, even sometimes when they may be frustrating situations, and think about that other person and what they may be going through. And then take a moment to even understand why you may feel frustrated, and see if you can find someone to talk to. I would encourage you, if you want to talk to somebody, you can talk to the digital president. He's there 24/7, and he loves to talk, and we're going to try to provide even more about wellness through the digital president, because we know that a lot of you all have challenges that you're dealing with. the provost, speak for the provost, Brian, and for Erica, we really do appreciate this opportunity to actually speak to you. And in the coming months, I'm sure we'll take this opportunity to talk again, because there's no telling where we'll be. But let's hope that we're safer. Let's do that by making sure that we do try to mitigate risk on an individual basis as much as we can. Know that as a university, we do care about each and every one of you, and that we'll make this campus as safe as we know how we can do. Thank you very much.